If you're watching this, I've told you in the office to look at the glenohumeral arthritis and replacement video. There are two different types of replacement, and so I'm going to go through and describe them all. First of all, one of the reasons you're looking at this is you've developed arthritis. Arthritis is when the cartilage wears away. Because of the contact between the bone of the humerus and the bone of the glenoid, the cartilage gets pinched in between. Depending on what your activities are, whether it be an overhead labor, whether you've done sports, whether you had dislocations, you can sometimes damage that cartilage, and the cartilage does not have a great blood supply. So because of that, the cartilage can fibrillate, meaning that it just shreds off. There's a smooth layer on top, the laminus splendens, and once that wears off, it looks more like crab meat. And that does not do well with your joint. So occasionally you'll get down to the point where it's bone-on-bone contact. And you'll know that because when you try and move your shoulder, especially if you're lifting to the side and coming down, it will cogwheel. It will stop and then move, stop and then move. We do try and treat this conservatively, as we try and treat everything conservatively, and oftentimes people choose to live with an arthritic shoulder. The reason for that is it's not like the hip or knee where you're stepping on it every step of the day. If you don't move your shoulder or lift high up, then you're not going to have as much discomfort. But sleeping will still be a problem. If you get to the point that you can't tolerate that, there are other conservative modalities that we can do. We do want some physical therapy to strengthen the muscles around the shoulder to improve the balance and hold that shoulder in place. In addition to that, if the pain is the issue, then we will occasionally give you an injection with steroids. The steroids is an anti-inflammatory that goes either into the joint or in the top of the joint to decrease your pain and help you tolerate your arthritis. There is also lubricants, and the lubricants sometimes can be injected into the joint, and that can lubricate the surface in hopes that you'll be able to tolerate the symptoms longer. However, if you get to the point where you can't tolerate it, where it's giving you pain all the time, when you can't lift anything, and it gives you a significant discomfort, we would think about a replacement. There are two different kinds of replacement. One is a regular shoulder replacement, and the other is a reverse prosthesis. We're going to start off with a regular shoulder. With a regular shoulder replacement, your rotator cuff needs to be intact because the mechanics of the shoulder, you need to have that depressing effect of the supraspinatus, the rotator cuff on top, so that you don't fail the glenoid side. When you do a replacement, you replace both the ball and the socket to maximize your motion and decrease the amount of pain that you're experiencing. If there is a rotator cuff deficiency and you put a regular total shoulder in, it will fail. So the regular total shoulder is done through an anterior incision in the front of the shoulder. It is not arthroscopic, it is an open procedure. Most of them we do at an outpatient facility in our surgical center, but they can be done in the hospital if you need to stay overnight. It takes about an hour and a half. You do get a block associated with it, and that block is called Expro. The benefit to that is it is a long-acting liposomal bupivacaine, so that means it lasts for several days. We do it as a block, but we also do it as a peripheral block, and that decreases the pain requirements that you have. In addition to that, we put a cryo cuff on the shoulder. The cryo basically decreases the amount of pain and decreases the amount of swelling, so hopefully you won't take much in terms of narcotics. It is a straightforward procedure for me, but I know it's a big procedure for you. So if you have any further questions, talk to me at the surgical center and I'll fill you in on that. The other procedure that I talked about is the reverse prosthesis. If that rotator cuff is deficient, then the head will ride high against the acromion and you will get persistent pain. So because of that, we need to do a reverse prosthesis. What that is a normal shoulder has the ball on the ball side and the socket on the socket side. With the reverse, we put the ball on the socket side and the socket on the ball side. We actually make your arm a little longer. So you'll notice postoperatively that you don't have that rounded contour of your shoulder. It'll be more straight down. The reason we do that is we're changing the mechanical function of the deltoid. We're putting more tension on it, so the deltoid is going to act as your rotator cuff. So it's going to simulate the supraspinatus rotator cuff that you have lost. Both procedures work very well, and if you have any further questions, you can ask me in the office or at the surgical center at the time of the procedure. But I'd prefer you ask in the office so we can adequately address all of your issues.